What diseases are the most terrible to have? Radiation exposure and poisoning. There was a case of radiation poisoning in Japan in 1999, where the patient was deteriorating/disintegrating on the hospital bed for 83 days after radiation exposure. His skin and internal organs broke down, he had diarrhea and dehydration, blood was leaking from his eyes, he was leaking fluids, he could no longer eat after 2 weeks, and they couldn't administer anything intravenously due to his tissue and cells being unable to repair or even hold themselves together. He had regular heart attacks as well, to which he was revived frequently. The patient's name was Hisashi Aoki.
This story about Hisashi Aoki is pretty intense. The details of his suffering are hard to grasp. It's shocking how radiation can cause such extreme physical breakdown. The repeated heart attacks and inability to eat or receive treatment show how severe the situation was. It's a grim reminder of the dangers of radiation exposure and its effects on the body over time.
EB/butterfly syndrome. Skin so fragile you can't touch it, like the wings of butterflies. Constant bandaging which can cause the tears and blisters that it's trying to protect from. Constant worry about infection and what body part is going to be mutilated from scarring. Constant severe pain. In some cases, it affects the digestive system, respiratory system, urinary system, and genitals. It can be fatal in cases where scar tissue or blisters has destroyed organs or left the areas too narrow to function, lungs, esophagus. And obviously sepsis.
That's a heavy read. The challenges these individuals face with such a fragile condition are intense. Constant pain and the risk of infection sound really tough to deal with. It's hard to imagine living with something that affects so many aspects of life. The possibility of serious complications like organ damage adds another layer of difficulty. Definitely not easy for anyone going through it.
It's not a disease, but if you get stung by a gimpy plant, you will probably wish you would die. It's described as the most dangerous plant. Long-lasting sting can last for months, extremely painful pain that feel like being burnt by acid and electrified at the same time, description by scientist Marina Hurley, and the pain can be reactivated when taking a shower. It had been renamed the suicide plant because it's known that a man took his own life after being stung because he couldn't withstand the pain.
That's a rough story. The gimpy plant really lives up to its reputation. It's crazy how something natural can cause that much suffering. The fact that pain can come back during a shower is pretty wild. It's sad to hear about someone taking their life due to it, showing just how serious this is.
New to healthcare and asked a coworker from the Philippines what the worst she's seen is. She said she has a patient that contracted HIV and as a result of lowered immune system contracted something else that made these blisters form all over their body and have a constant fever. She said the blisters were extremely painful and would regularly pop. She said he begged for her to kill him but they don't do comfort care in the Philippines so he just suffered till he died. She said she can still see his face, and that's when I realized why you don't ask healthcare workers shit like that.
That's a heavy story. It shows the harsh realities some healthcare workers face. Asking about tough experiences can lead to unsettling answers. It's a reminder that behind the medical profession, there are real human experiences filled with pain and suffering. It's definitely not a light topic. Just reinforces the need for compassion in healthcare.
As a student in the medical field, I had a brief and unexpected exchange with a neurosurgeon on this topic. A patient came in after falling down a flight of stairs and was in bad shape. The doctor was leaning forward in his chair, twisting a pen in his mouth with one hand and scrolling through individual slides of the patient's MRI scan with the wheel of his mouse in his other hand. Suddenly, he stopped, sat back in his chair, tossed the pen onto his desk, and let out a huge sigh. "Me, what do you see?" "Doc, there are 3 things in this world that would make me reach for my top-shelf bourbon and my .357, ALS, Lou Gehrig's disease, glioblastoma, and this." And he pointed to his computer screen. I probed further. "Me, what is it about this that would make you want to do that?" "Doc, you see that dark area? That's blood and it's not supposed to be there like that. What I have to do is, remove the top of the skull, and suction the coagulated blood." "Me, okay. Doc, blood stains gray matter." "Me, I still don't fully understand." "Doc, I won't know if I'm suctioning blood or brain during the surgery." "Me, oh. I'm beginning to understand. Doc, if this patient doesn't die on the table, they'll live the rest of their life in a vegetative state." Me, quietly, oh, fuck. Doc, oh fuck, is right.
That exchange highlights the weight of the situation. The neurosurgeon's straightforwardness about the patient's prognosis is chilling. It's tough to grasp the reality of surgeries where the line between saving a life and causing irreversible damage is so thin. It's a stark reminder of the fragility of life and the heavy decisions that come with it. The doctor's bluntness gets the point across effectively.
Epilepsy. I currently have mild cognitive impairment, you can even call it that. I can forget the content of a video I watched the previous night. My right shoulder has been dislocated 14 times. From experience, it is more painful than a broken rib, but I am not a candidate for surgery because I have breakthrough seizures, and one of the medications I'm on is a slosh drunk simulator that also gives me dreams based on real life that are so vivid that I wake up disoriented, and I think it also worsens memory too. Epilepsy eventually leads to dementia, and I'm only 23. Physically, I'm lucky that I've only had dislocated shoulders, a broken rib, painful canker sores from biting my tongue that make it hard for me to enjoy my favorite foods, and a scar underneath an eyebrow from when I had a tonic-clonic seizure when I lived at a place where the bathtub was in front of the toilet. A piece of advice for all of you: screaming will not move you up the triage list of speed up the process of your treatment when you are in the ER.
I'm sorry to hear about your struggles. Dealing with epilepsy and all those physical issues sounds really tough. It must be frustrating to have memory problems and vivid dreams from your medication. The whole situation with the ER is a real eye-opener too. Hope you're finding ways to manage it all, even if it's just one day at a time.
Parkinson's. I was an IOL home care nurse for a 70-year-old man who passed in January. I watched him go from driving his little white truck every day and only needing physical therapy to unresponsive and bedbound in the span of 13 months. His body just stopped working on him. He was an irritable old man, but he was amazing. He was an artist, and I helped him finish his studio that he'd never get to paint in. I helped him finish a few of his paintings before he lost all ability to hold a pencil. He passed fairly quickly, but up to that point, he lost all control of his motor functions. There's something horrible about losing control of your body and losing the ability to create, something that you did every day up until that point. I miss him a lot. We had a lot of long conversations. He loved my favorite band, and I got to keep some of his art. I would do anything to go back to them now. Miss you, John.
That sounds intense. It's tough to see someone go through such a decline, especially someone who was full of life. Helping him finish his art must have felt meaningful, even if it was sad. Those memories you shared seem to hold a lot of weight. It's clear he made an impact on you, and it's okay to miss him. It shows how important those connections are.
My dad has cerebral atrophy. In particular, one called olivopontocerebellar atrophy where there is no medication to even alleviate symptoms. It's a combination of Parkinson's and ALS with the tremors, muscular atrophy, impaired coordination, balance issues. Loss of vision because both eyeballs tremor. Starting to lose ability to control bladder, slurred speech. He's only 60 and he's had this for 7 years. I'm his sole caretaker and it's awful to see him deteriorate like this as well as myself mentally and emotionally.
I'm sorry to hear about your dad's condition. That sounds really tough, both for him and for you as his caretaker. Watching someone you care about go through such a decline can be draining. It's understandable that it affects you emotionally and mentally. Just taking it one day at a time might help, even when things feel overwhelming.
Me/CFS, also known as myalgic encephalitis/chronic fatigue syndrome. It's a post-viral illness that damages the immune system, and one of the most common symptoms of it is crushing fatigue so intense that, at its most severe, people become unable to sit up in bed, tolerate light or sound, or chew and swallow food. An example of a famous person who has it is Diana Cowan, Physics Girl. There are no known treatments or cures for it either, and there's no known way to prove who's most at risk for it, but some risk factors include being female and being a young adult or middle-aged.
It's tough to read about me/CFS. Crushing fatigue that stops people from normal activities is serious. The fact that there's no treatment or known way to predict who will get it makes it worse. Diana Cowan's case shows that even those in the public eye can struggle with it. Overall, it highlights how some health conditions can really impact lives without clear answers.
Huntington's. Your brain slowly deteriorates until you're a shell of who you were and then you die. It impacts your personality, making you sometimes violent, unable to be reasoned with and unable to take care of yourself. By the end, your loved ones being to hope you just die so the good memories of you stop being corrupted by what the disease has reduced you to. I watched it happen to my wife's father and she is at risk for it. There isn't a day that goes by that I don't think about it happening to her. Just terrified that someday I won't love her anymore as I take care of her until she dies. She's going to get tested in a few years so we know for sure and can determine if we can have kids without worry about passing it on to them.
That sounds really tough. Watching someone you care about go through something like that must be hard. The uncertainty and fear about the future can weigh heavily on you. It's good that you're thinking ahead regarding testing and family planning. It's a difficult situation to navigate, but being aware of it can help when making those decisions later on. Just taking it day by day is important.
Severe myalgic encephalomyelitis, aka chronic fatigue syndrome. Research has proven beyond reasonable doubt that it's a serious medical condition with bleak prospects of recovery. But most people think it just means you're a bit tired or lazy, and it has a tortured history of being misclassified as a psychological illness. Severe sufferers have a miserably limited existence with constant pain and inflammation throughout the body, particularly the brain. There are only a small number of experts in the condition, and most medical professionals are ignorant about it and will gaslight patients. The public at large have no sympathy. Many folk who've had other serious illnesses including cancer say the lived experience with severe ME/CFS is far worse.
This story highlights how misunderstood conditions like chronic fatigue syndrome are. Many people don't realize the severe impact it has on someone's life. The lack of knowledge among medical professionals and the public seems to make it even harder for those suffering. It's frustrating to see such a serious issue dismissed or mistaken for something less significant. Recovery seems really difficult, given the circumstances.
The disease I have isn't really comparable to other things in this thread, but for a while I was in a deep spiral about it. It's a chronic progressive disease, most people won't improve and will just go downhill, forever. I'm in my 30s. I started to think one day that there's absolutely no way I can handle this for another 20 to 40 years. I was thinking recently that some diseases, while way worse, are so final, you know you're going to die and then it's over. I have still not got my head around how to do this for another 20 to 40 years. Having this as an old person is going to suck.
That sounds really tough. Dealing with a chronic progressive disease can take a toll on your mind and spirit. It's understandable to feel overwhelmed thinking about long-term challenges. Many people would struggle with that kind of uncertainty. Finding support and ways to cope could help a bit, but it's not easy. Just taking things one day at a time might be the best way to manage it all.
You can't just post rabies without including the classic copypasta, rabies. It's exceptionally common, but people just don't run into the animals that carry it often. Skunks especially, and bats. Let me paint you a picture. You go camping, and at midday you decide to take a nap in a nice little hammock. While sleeping, a tiny brown bat, in the rage stages of infection, is fidgeting in broad daylight, uncomfortable and thirsty, due to the hydrophobia, and you snort, startling him. He goes into attack mode. Except you're asleep, and he's a little brown bat, so weighs around 6 grams. You don't even feel him land on your bare knee, and he starts to bite. His teeth are tiny. Hardly enough to even break the skin, but he does manage to give you the equivalent of a tiny scrape that goes completely unnoticed. Rabies does not travel in your blood. In fact, a blood test won't even tell you if you've got it. Antibody tests may be done, but are useless if you've ever been vaccinated. You wake up, none the wiser. If you notice anything at the bite site at all, you assume you just lightly scraped it on something. The bomb has been lit, and your nervous system is the wick. The rabies will multiply along your nervous system, doing virtually no damage, and completely undetectable. You literally have no symptoms. It may be 4 days, it may be a year, but the camping trip is most likely long forgotten. Then one day your back starts to ache. Or maybe you get a slight headache. At this point, you're already dead. There is no cure. The sole caveat to this is the Milwaukee Protocol, which leaves most patients dead anyway, and the survivors mentally disabled, and is seldom done. There's no treatment. It has a 100% kill rate. Absorb that. Not a single other virus on the planet has a 100% kill rate. Only rabies. And once you're symptomatic, it's over. You're dead. So what does that look like?
This story paints a pretty unsettling picture of rabies. It casually highlights how someone can be completely unaware of a tiny bite leading to such a severe outcome. The idea of a seemingly innocuous camping trip turning deadly is pretty intense. It raises awareness about the dangers lurking in nature. The finality of rabies, with no treatment available once symptoms appear, is a stark reminder of how serious certain infections can be.
My father died of ALS several years ago. It was awful. My mother was diagnosed with Alzheimer's last week. It feels so very unlucky and unfair. Ada, thank you for all your well wishes. I'm hopeful I get many more good years with my mom. It's early yet. But Dad was gone less than 18 months after diagnosis. He had the fast-moving ALS that starts in the chest, which I find to be less horrible than the slow crawl usually associated with the disease. I still don't know which I find worse, losing your body and keeping your mind, or losing your mind but keeping your body. Ick, sad face.
That's a heavy situation. Dealing with loss and now facing another diagnosis is tough. It's understandable to feel unlucky. Wishing for more time with your mom sounds reasonable, especially since it's early. It's hard to compare how people experience these diseases. Each situation has its challenges. Just take it day by day, I guess. Hope you find the support you need.
My old neighbor had ALS. The only thing he noticed was a trembling in his right pinky which wouldn't stop or go away. At first he thought it was something like a spasm or stress-related, but it wouldn't go away, and when he finally had it checked out a half year later the diagnosis was ALS. Super sad since he was in his mid-30s and had 2 young kids. Seeing a guy who was fit as can be, he ran multiple marathons per year, slowly turn into a vegetable, sorry, I have no other word for it, was heartbreaking. He managed to live for a couple of years, but in the end he decided the quality of life had become so bad that he decided to undergo euthanasia, which, fortunately, for him in his situation, is a legal option in the Netherlands.
That's a really tough situation. It's hard to see someone active and healthy face such a decline. It must have been painful for his family too. Euthanasia being legal in that context does bring some comfort, even if it's a difficult choice. Hard to imagine how he felt going through all of that. Life can really change in unexpected ways.
My family has a genetic form of ALS. There's a 50% chance of inheriting the gene mutation, and if you have it, you're 99% likely to develop the disease. My dad was the first in our family to show symptoms. He was 58, began having symptoms in September 2009 and died in August 2010. He was wheelchair-bound and we were feeding him. We have a fast decline gene mutation. My brother, 29, was diagnosed in 2020, his symptoms were 1, dropped foot. He's still alive today but can't even use his eye tracking machine anymore because the machine can't detect his eyes now. He draws letters with his eyeballs to communicate. My sister, 47, tested positive for the gene mutation and has not developed symptoms yet. She's basically waiting for it to start. Thankfully I got my genes tested and I did not inherit the gene mutation. I have 2 sisters who have chosen not to learn their gene status, and I understand why. The disease is terrible. Some drugs have shown to slow down progression, but nothing stops it or reverses it.
It's a tough situation, dealing with genetic illness in the family. Seeing your dad go through that must have been hard. Your brother's experience is really challenging too, especially with the limitations he faces now. It's understandable why your sisters would avoid testing. Living with that uncertainty can be really heavy. At least you got some clarity with your own test results. The whole thing just seems unfair.
The only problem is when said patients lose the ability to convey their desire to die, or are simply too brain dead to do so. If you're in a coma, can't talk anymore, or lost cognitive abilities, you're at the mercy of your relatives who can decide to keep you alive in the case God decided to do a miracle and take you out of your misery. My uncle had cancer, and while he fought heroically, at the latest stages he wasn't even able to talk, and his relatives insisted of keeping him alive. When his oldest daughter demanded the doctor to unplug him, the other sons entered into a feud and keep on calling her a murderer and an inheritance seeker, which ultimately broke this family. On the other hand, you never know how you'll react egoistically when someone closest to you is dying and that your only choices is to say your goodbyes now or try to believe they'll get better.
This scenario highlights some tough choices. It's hard to imagine being in that position, especially with family conflicts over end-of-life decisions. People can react really differently when emotions run high. The struggle between wanting to let someone go and hoping for a miracle is intense. Ultimately, it raises questions about how we value life and the role of family in such decisions. It's a complex situation with no easy answers.